to the Friday Five here on the Agent Survival Guide podcast. I'm your host, Sarah Ruppel, and this is our list of 5 things you should know about. Today is December 12th, and that means that coming in at number 5, you have survived the 2026 annual enrollment period. So congratulations to our agents selling Medicare. You've made it through another busy season. Earlier this week, we published our annual episode, Things to Think About Post AEP. So if you haven't had the chance to listen to that yet, we will be linking to it in the episode notes. Number 4, last week, Spotify Wrapped came out, and I have been waiting to share some highlights with you. I'll be sharing my personal Spotify Wrapped listening stats on social in the coming days. But the fun thing about having a podcast on Spotify, we also get a Spotify Wrapped for the podcast. And there are a couple of stats that I want to call out here in this episode. We have been fortunate to see continual growth in our audience since the podcast began back in 2017. This year, our podcast, Spotify Wrapped, reported a 27% increase in followers from last year to this year. Our audience listened from 20 countries in 2025. Our podcast made it into the top 5 podcasts of over 100 fans and the number 1 show for 26 fans. And then a stat that we used to be able to view on a monthly basis that I still really miss, the top artists of our Spotify podcast listeners. Fleetwood Mac, Zach Bryan, Drake, Morgan Wallen, and Taylor Swift coming in at the top spot. Another fun stat, the audiobooks that our Spotify podcast audience is listening to, and there is a range here as well. Sorry I'm Late, I Didn't Want to Come by Jessica Pan. Self-Discipline by Steve G. Martin. Killing Lincoln by Bill O'Reilly and Martin Dugard. Great Big Beautiful Life by Emily Henry. And coming in at number 1, the audiobook Fanatical Prospecting by Jeb Blount and Mike Weinberg. Couple other very cool stats. Our show's growth outpaced 99% of other shows, earning us the 2025 Rising Star badge. Our Spotify fans listening to the ASG podcast for longer than 87% of other shows, that gave us the 2025 Marathon Show badge. And because of your generous sharing habits, we were a 2025 most shared show on Spotify, receiving more shares than 76% of other shows. I just want to say thank you so much to all of our listeners, because we wouldn't be seeing stats like that without you and your listening habits. So thank you for listening, liking, and sharing what we are making here. We really appreciate you including us in your listening rotation. It means a lot. Number 3, an interesting update in the smart ring space. Pebble recently introduced their offering, the Index 1, and it has more in common with the Sandbar Stream Ring that we talked about at the beginning of November than the Aura Ring. According to Pebble's founder, Eric Mijakovsky, he's not as interested in health monitoring or complex AI capabilities. The Index 1 is mainly for dictating reminders that can then be turned into notifications with the Pebble app. Users press and hold the button on the ring to record. The recording is sent to the Pebble mobile app. Within the app, speech-to-text AI translates what you said into a note or reminder. And there are other apps that can integrate with the Pebble app. And it sounds like the groundwork is there for customizations to be built on the open source tech. The Index 1 differs from Aura and Stream Ring in that it is not rechargeable. It runs on non-rechargeable silver oxide batteries that are estimated to last about 2 years, giving the user between 12 and 14 recording hours for the lifetime of one battery. That might not seem like a lot of time, but individual recordings are capped at 5 minutes. And again, users do have to hold the button for the entire time they're recording. The Smart Ring will be priced at $75 during the pre-order phase, which ends in March 2026. After that, the price will increase to $99. Personally, I like that this takes what I liked about the Sandbar Stream Ring, simplifies it, and makes it less expensive. Now, it's a little late to add it to my holiday wish list, but definitely not too early to be thinking birthday or Mother's Day. Moving on to number 2. Nothing to report so far on the ACA subsidy front. Still a lot of talk going around about that. But CMS did release the first national snapshot on 2026 Marketplace open enrollment. So far, the total enrollment reported for all exchanges is at 5,757,039 plan selections for the 2026 coverage year. The overall number of enrollments so far is higher than last year's overall numbers. In the same report from last year, enrollment was at 5.3 million plan selections. Breaking down the almost 5.8 million plan selections for coverage year 2026, almost 950,000 are new consumers, while 4.8 million are consumers returning to the marketplace. Now, initially, I was surprised to see how the overall numbers reported so far stack up against that same report from the 2025 open enrollment period. But when you get into the state-by-state breakout, there's a shift in our snapshot. Despite the fact that enrollments are overall currently up for coverage year 2026 compared to 2025, when you look at the breakout state by state, most states are currently reporting a decrease in enrollment. In fact, 30 states are currently reporting a decrease in their marketplace enrollment for 2026 compared to 2025. 20 states and the District of Columbia are reporting an increase in their marketplace enrollments. Here in Pennsylvania, we had over 46,000 enrollments by the time of the first CMS Marketplace snapshot last year. Currently, we have over 56,000 plan selections that have been made. CMS breaks those enrollment numbers out for every state. Very interesting to see where we are at so far in this first snapshot, and I will be curious to see where we're at just after the new year with the second snapshot. We'll be linking to the 2025 and 2026 open enrollment period initial snapshots in our episode notes. And coming in at number 1 this week, continuing on with our theme of recaps, stats, and snapshots, KFF released their 2026 Medicare Advantage Spotlight First Look. KFF creates this annual report after analyzing 2 different sets of data. The first, CMS landscape data from 2010 through 2026, and the second, the Medicare Enrollment Dashboard from 2024 to 2026. Now, this report was a little later than normal this year. Normally comes out around the 3rd week of November, but was likely delayed due to the government shutdown. There are a lot of great stats in here. And again, KFF reports on these annually, so it's one way to see how the plan landscape and enrollment changes from year to year. Now that we've got the background out of the way, let's get into the stats. Starting out very high level, in coverage year 2026, there are a total of 3,373 Medicare Advantage plans available nationwide. That is a 9% decrease from the almost 3,700 plans available in 2025. For coverage year 2026, the average beneficiary has access to 39 Medicare Advantage plan options, 32 of which are Medicare Advantage prescription drug or MAPD plans. That is a decrease in both types of offerings compared to what was available to beneficiaries in 2025. The average beneficiary could choose from 42 MA plans, 34 of which were MAPD plan options. Getting into Medicare Advantage plans by type. First, Health Maintenance Organization or HMO plans make up 57% of all MA plans with 1,911 plans. Local Preferred Provider Organizations or PPOs, on the other hand, make up 42% of MA plans. Number-wise, that comes out to 1,403 local PPO MA plans. What's interesting here is that percentage-wise, there's not much of a change between 2025 and 2026 data. In 2025, HMOs made up 55% of the MA landscape, while local PPOs made up almost 43% of MA plan totals. Digging into the numbers, however, while the percentage of HMO plans offered did increase by 1%, we still saw a decrease in the number of plans available, for a loss of 155 plans. Local PPO plans offered decreased in both areas. That 1% drop in PPO plans offered represents a loss of 185 plans. KFF also breaks out data by state. One map shows the change in Medicare Advantage plan availability, color-coded to note whether plans increased, decreased, or stayed the same. Then, when you click into each state, it shows the number of plans available in 2026 versus 2025. Here in Pennsylvania, where Ritter Insurance Marketing has its headquarters, we saw a decrease in Medicare Advantage plans, with 53 available for coverage year 2026, a decrease of 5 plans from the 58 plans available in 2025. In Texas, the headquarters of our partner, Integrity, plan availability held steady with 36 Medicare Advantage plans available for both coverage years 2025 and 2026. Also included in the report, a more granular map that breaks down plan offering by county for both 2025 and 2026. On both of those color-coded U.S. maps, you can toggle between 2025 and 2026 to compare. Love it when KFF includes interactive elements like this in their reports. Now, let's talk about plan availability for the average Medicare beneficiary, and then we'll talk carriers. Always like taking a look at these statistics, and these all pertain to coverage year 2026. 25% of Medicare beneficiaries have a choice of 31 to 40 Medicare Advantage plans. 17% have 21 to 30 MA plans to choose from. 16% have 41 to 50 MA plans to choose from. 15% have a choice of 51 to 60 Medicare Advantage plans. 13% can choose from 61 or more plans. 9% fall into the 11 to 20 plan choice range. 3% of beneficiaries have 5 to 10 plans to choose from. 1% of beneficiaries have just 1 to 4 Medicare Advantage plans to shop. And then 1% of beneficiaries have no Medicare Advantage plans available to them. When it comes to the amount of carriers a beneficiary has to choose from, 29% have 10 or more Medicare Advantage plan carriers to shop. 27% have the option of 6 to 7 different MA plan carriers. 20% of Medicare beneficiaries have 8 or 9 MA carrier choices. 15% have 4 or 5 Medicare Advantage carrier options. 7% of beneficiaries have 2 to 3 carrier options for their Medicare Advantage plan. 1% of Medicare beneficiaries have just one carrier option for Medicare Advantage coverage. And then again, 1% of Medicare beneficiaries have no option for Medicare Advantage coverage at all. Percentage-wise, these numbers are also a decrease in availability compared to last year. But I think these numbers still highlight the very, very real need for an agent to help sift through these coverage options. In a related report, KFF details plan premiums and benefits. Couple notes to highlight here as well. In coverage year 2026, 67% of all Medicare Advantage plans with Part D prescription drug coverage will charge no premium. Same percentage, but with less overall plans. That means that the number of actual MAPD plans with no premium has decreased. Supplemental benefits, other than dental, vision, and hearing in Medicare Advantage plans, have also decreased from 2025 to 2026. Benefits such as the OTC allowance, meal benefit, remote access technologies, and transportation were found in less plans in 2026 than in 2025. And then the last thing I'll mention here, the Part B premium reduction, a benefit that not all Medicare Advantage plans offer. Only about 32% of Medicare Advantage plans offer that benefit. 68% of plans offer no Part B rebate at all. And just a note on cost there, for coverage year 2026, the full cost of the Part B premium comes in at $202.90 per month. Now, KFF breaks out a lot of other information in both of these reports. They go granular on the availability of plans by carrier and county, as well as getting into plan entries and exits in the plan offerings report. And then on the premiums and benefits side, there's a breakdown of MA plan cost by percentage, a detailed info comparison on extra benefits available in MA plans from 2021 through 2026. There's data on special needs plans, a breakout on the Part B rebate amounts, and so much more. So we will be linking to both of those reports in the episode notes. Highly recommend checking those out. And then for a little bit of housekeeping, next week will be our last Friday 5 episode of 2025. But stay tuned because we have plenty of other content coming during the week. And then we will hit the ground running with our first Friday 5 episode of 2026 coming in on January 9th. But for today, I hope you have a great Friday. And I hope that leads into a fantastic weekend. Stay healthy and stay safe out there, and we will see you next week. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written and produced by me, Sarah Ruppel. Script editing and fact check by Tina Lamoureux. Podcast design by Urban Rivera. Follow along with our show wherever you like to listen.